Thank you. Good afternoon, everybody, and thank you for this opportunity to share with you the findings from SWOG SO230, or POEMS, the Prevention of Early Menopause Study. Ovarian failure is a common and potentially devastating consequence of chemotherapy for breast cancer, as the cycling ovary may be particularly susceptible to damage from chemotherapy. Preventing ovarian cycling during chemotherapy with hormone-suppressing drugs such as goserelin has been investigated for preserving ovarian function. Prior studies, however, have been inconclusive, and few data are available on pregnancy outcomes with this approach. POEMS was a phase 3 randomized study that included premenopausal women aged 18 to 49 with hormone receptor negative early stage breast cancer. This is a situation in which chemotherapy is given with curative intent. After stratification for patient age and planned chemotherapy regimen, study participants were randomized to receive either standard cyclophosphamide-containing chemotherapy alone or cyclophosphamide-containing chemotherapy with the addition of goserelin. The goserelin was given as a subcutaneous injection once a month for the duration of chemotherapy, beginning at least 1 week prior to the first dose of chemotherapy. The primary endpoint of POEMS was the rate of ovarian failure at 2 years, defined as having no menstrual periods for the prior 6 months and an FSH level in the postmenopausal range. By this definition, the ovarian failure rate was 22% in the standard chemotherapy arm and was 8% in the goserelin arm. In the stratified analysis, this represented a 70% reduction in ovarian failure with a p-value of 0.04. Using a less stringent ovarian failure definition of either postmenopausal FSH or absent menstrual periods for the prior 6 months, 45% of patients in the standard arm versus 20% in the goserelin arm experienced ovarian failure. This difference was highly significant, with an adjusted p-value of 0.006. Similarly, the rate of ovarian dysfunction at 2 years, defined as no menstrual periods for the prior 3 months, and either an FSH, estradiol, or inhibin B level in the postmenopausal range, was reduced by close to 2/3, with 14% of the patients in the goserelin arm experiencing ovarian dysfunction, compared with 33% in the control arm. This was significant with a p-value of 0.03. We also looked at pregnancy outcomes. In the control group, 11% of patients reported becoming pregnant, with 7% actually delivering a total of 12 babies. Plus, there were an additional 2 control group patients who were still pregnant at the time of data submission. In the goserelin group, 21% of participants became pregnant, with 15% of the entire group delivering a total of 18 babies, with an additional 3 women in the goserelin group reporting ongoing pregnancy at the time of data submission. The greater than 2-fold difference in becoming pregnant and in having a successful pregnancy outcome were associated with p-values between 0.03 and 0.05. POEMS also looked at disease-free and overall survival. 4-year disease-free survival was 78% in the control group and 89% with the addition of goserelin. 4-year overall survival was 82% in the control group and 92% with the addition of goserelin. When adjusted for age, chemotherapy regimen, and cancer stage, the p-value for disease-free survival was 0.04, and the p-value for overall survival was 0.05. To conclude, the use of goserelin during curative intent chemotherapy for early stage breast cancer led to better preservation of ovarian function than if goserelin was not given. This is the first demonstration of improved fertility for more successful pregnancies when goserelin was used. The favorable outcomes for both disease-free and overall survival are very reassuring regarding the safety of this approach. Premenopausal women beginning chemotherapy for early breast cancer should consider this new option to prevent premature ovarian failure. Thank you very much.
We're going to have questions.